Hey, Dr. Tyler Williams at Pinecrest Dental. We're here today because you have some questions about different types of implants and how they work. And so we'll go through those with you to help you be in the know of what to expect and what to plan for. And the first thing to know is that the word implant is kind of overused, and it's such a broad term it can mean a lot of different things, especially in dentistry. You have implants that are single teeth. Okay, so say I get hit with a baseball and it knocks one tooth out. I'm going to get a single implant, which is usually a single screw with a ceramic tooth attached to it that goes in that spot to replace that whole tooth. Or if it had knocked out 3 teeth, I might get 2 or 3 implants in there that are screwed in, but I'm keeping all the rest of my teeth. All right, so that's one type of implant. The type of implants that people hear about more often, sometimes get confused with those type of implants, is where you have all of your teeth taken out, or all of your top teeth taken out, or all of your bottom teeth taken out, and you get multiple implants in, and then you get a bridge or an appliance or something that screws in or snaps in to replace your teeth. Okay, so those are full mouth or partial mouth implants, whereas the first kind I mentioned would be like a single tooth or a couple tooth implant. Okay, so similar concepts, just very different on who we're treating. So the latter type, where you're getting multiple teeth done, or all of your mouth or most of your mouth, that's usually where you have a lot of teeth that are broken, cracked, missing. This is what we would call replacing, versus if you've just got 1 or 2 teeth, usually we would call that renewing your smile, where it means, hey, we're keeping kind of what's there, we're just adding a few things back that were damaged. When we're replacing your smile is when we're taking everything out that's bad, and you're going to have a major life-changing experience. It's almost always for the better, where you're going to get a new smile, new confidence. You're going to feel better. Your mouth's going to be healthier. You're going to get rid of the pain and the aches and the bleeding gums and the lack of energy that so many people have. And it does require some time and work. It's usually anywhere from a 6 to 12 month process. You do get teeth in the first visit, so that's why it's called teeth in a day, but it takes multiple visits to do the follow-up work to get those done. And often you're wearing transitional teeth going through your journey until you get into your final teeth. Now, the question a lot of people ask is, what are better, snap-in teeth or screw-in teeth? And to give you some context is, you would go, on the low end would be a denture. A denture are just suck-in teeth. No implants, doesn't clip in anything, just suction cups in your mouth. Most people don't love them, especially on the bottom. Most people end up hating them. So we do everything we can to avoid a bottom denture, and you should do the same. So you might do okay with an upper denture, but on the bottom teeth, stay away from a denture. They just don't fit well. They don't suction in well at all. Hard to chew foods with 95% of people. We do have a very, very, very small population that can chew pretty well with lower dentures, but you don't know until you lose your teeth, and sometimes it's too late. Now, the middle option would be snap-in teeth, and that's where you get multiple screws placed in your mouth, implants, and then you have a bridge that clips in and clips out. And those are nice because you can take them out and clean them. They're easier to use, easier to maintain. Then you have the screw-in type, where you get multiple screws in, just like you do with a snap-in bridge, only with these ones, they are fastened in and they're permanently in, so you don't take them out. Now, most people like the screw-in one. They like that the teeth don't come out. They like that they're in there permanently. They can chew most things well. But there are some disadvantages. With the snap-in teeth, they're not going to fall out when you're talking to your friend or, you're at dinner. But the difference is they kind of move like struts on a car. So snap-in teeth, when you chew, the whole thing kind of moves and rotates a little bit. They clip into those implants, and then you have to pull pretty hard to get them out, usually between meals or at night. You brush them a couple times a day. Again, the advantage with the snap-in is you can do a lot of the maintenance yourself. It's easier. You can take them out. You can brush the screws. You can brush the bridge. You can clean underneath it, shoe shine around it with some gauze or floss. And the parts are easier to replace and repair over years and years as you wear things down. With the screw-in bridges, they're nice because you can eat 90 to 100% as well as if you had your own natural teeth. The downside is it takes a little longer to clean between them. You have to floss underneath them, maintain them, use a water pick or some little brushes underneath. If you don't do that, you'll get gum disease around your implants just like you would around your teeth. So one of the most common reasons for full mouth implants is people get periodontal disease or gum disease. You can also get peri-implant disease or implant gum disease, and that can cause your implants to come loose and fall out. So it is important to make sure you're keeping up with your maintenance visits and your checkups so you can have a long, lasting life of smiles. Your best option is to meet with a dental team that understands the pros and cons of both a snap-in and a screw-in. There are a lot of places that just offer one option, and that may not be the best option for you. And so you want to be able to discuss that, see some examples, see some before and after pictures, hear some stories from other patients like you who've gone through a similar situation, and go from there. So if you have some questions, please call us or email us. Our website info is below. Be happy to go through that with you. And if you'd like to take advantage of one of our upcoming implant consultations or join us for our implant seminar, please let us know, and we'll be able to find a spot or a reservation that works for you while they still last. So thanks for watching this video. We look forward to your feedback and input, and have a wonderful day. Thanks.